Hello, everyone. Well, we are so excited to have you here for PQMD's Self-Guided Impact Pyramid Workshop. This session is a part of the Partnership for Quality Medical Donation, or PQMD's, larger body of work we call Measuring for Success. This work aims to produce tools and resources and nurture a community around better monitoring and evaluation of medical product donations. Our signature resource is the toolkit, which you see here. We'll be working through it together today, and we're delighted to bring you this session. To best benefit, we do recommend that you familiarize yourself with the toolkit as well as the PQMD Impact Pyramid, which you can find right in the toolkit. We have also heard great feedback from PQMD members who have watched this session with other colleagues from their organization. So getting together a small team, inclusive of other team members, across functions, ideally in M&E or measurement or monitoring and evaluation, as well as programs, communications, other corporate relations, etc. A wonderful way to successfully reflect on how you as an organization articulate your desired outcomes, the pathways of getting there. My name is Laura Hollid. I'm a consultant supporting PQMD's Measuring for Success work. And along with the entire PQMD team, I'm happy to welcome you today and thank you for joining us. In case you're new to us, PQMD is a global alliance of international NGOs, as well as leading healthcare companies, working together to advance the role of quality product donations worldwide. You can learn more about our work and the work of our members on this website, www.pqmd.org. So prior to engaging in this module, we do hope that you've had some time to look through the Measuring for Success toolkit, as well as the pyramid itself that we'll spend some time on today. We do hope that you've had some time to think about your own organization's work and reflect on that and bring that to today, because there will be an opportunity to practice applying some of these principles to your own work. And that's what we will start today by providing context on the pyramid. So the toolkit itself, let me back up for a moment and share the toolkit itself. I think I showed you the first landing page here. When you arrive, you see this general welcome screen, and as well as below the table of contents. When you click into the toolkit itself, that table of contents moves to the left and allows you to navigate as you go. And there are many sections to the toolkit, and today we'll be really focusing on the impact pyramid section. But the impact pyramid is one of the newer tools that was developed in early 2022 by a collaborative work. And while there are certainly some general monitoring and evaluation, or M&E, concepts and approaches included in here, the most important value out of this toolkit is the specific topical lens of product donations applied to M&E. And so in addition to this toolkit providing those resources, you'll see here one of the toolkit's newest tools and most foundational frameworks. As you'll see, the pyramid has its own section, which I will walk us through, and it was designed to address a specific challenge. So in the medical product donation space, there is certainly a diverse group of organizations working together to leverage a broad range of approaches toward quality donations. Despite this variety of tools, we challenged ourselves as an organization best poised to do this work and bring people together to group these efforts and intended impacts into major themes. And that's what the pyramid does. We sought three major goals with developing this. First, providing this framework, this visual, for articulating how activities at the bottom drive impacts at the top. Number two is to set the stage for some metrics work that the organization is launching around really identifying the metrics that align with each of these components. And number three is more of a communications value add, that this pyramid actually illustrates the collective efforts across this diverse medical product donations ecosystem. So the pyramid does build upon earlier efforts of the Measuring for Success work and brings together the what, or the pathways at the bottom, and the so what, or the impact domains, as you move to the top. And in doing so, it really seeks to encourage a streamlined way of approaching, defining, measuring, key outputs, outcomes, and impacts that align with each of these components. So these components on the interactive pyramid here in the toolkit are possible. It's possible to click through each one and get more details about each component. So let's walk through one pathway and one impact together, just to show how we're really operationalizing these major components of the pyramid. So if we click on a pathway below that is common in the medical donation space, that we call signature donation efforts, we'll see, if you click to make the screen large, you can see a description at the top of what we mean by this pathway. So this one represents targeted, purposeful, often more collaborative, resource-intensive flagship efforts to donate products toward a clearly defined set of goals. And the activities aligned with this sort of pathway do intend to involve a broader range of partners and stakeholders, all the way from donors to implementers on the ground. Right underneath the description, we'll see a list of outputs. These are direct reflections of the activities conducted or the services rendered. And in this pathway are outputs like characteristics of products distributed by type, number, dollar value, amount, etc., partners engaged across various sectors, and more. And finally, at the bottom, you'll see some notes providing considerations related to how activities in these pathways might be best operationalized, so some best practices for activities in the space. If we click out, we can check out one of the impact domains. Let's try health system strengthening, which is grouped under the improved system efficiencies sort of bucket of impacts. This broad domain area is certainly important to many players working in the product donation space. And the description here covers how stronger, efficient, and effective health systems improve access to healthcare and health outcomes among the populations they serve. Certainly, again, a goal of many of the product donations works and efforts. And, some of the multidimensional aspects of this domain are covered here and are built out further in the outcomes area. So as you see, there are three sort of subdomains of this impact area that we've identified. They include health worker capacity, stock and supply of medicines, and availability of equipment. And then the outcomes are grouped according to each of these subdomains. For example, under stock and supply of medicines, we see donated medicines matching facility needs, decreased rate of stockouts, cost savings, etc. So at the bottom of each impact domain, you'll see certain considerations for evaluating these outcomes. And in this case, there's an acknowledgement of the application of surveys to assess shorter-term changes, contributing to the longer-term vision of stronger health systems, which is certainly a longer, complex shared goal. So again, as you're working through the exercise, especially the worksheet that we'll show you soon, which happens to be right down here, please note that you can always return to this pyramid and reflect on how your work connects to it, and it might help inspire the kind of work that you're doing in completing the worksheet, as well as how you're just generally articulating your work. So one other thing I want to say is it's important to note that the impact pyramid itself has roots in a core M&E framework called the logic model, a visual representation of theory of change, which articulates what activities your organization is leveraging and how it will yield outputs and ultimately outcomes, creating longer-term, broader impact. You can think of the pyramid as a high-level collective logic model for the product donation space, which has been flipped 90 degrees, so it goes from bottom to top. And notably, there are a variety of ways of representing visually one's theory of change, and some simply use a vertical representation, others more horizontal, and there are many options in between. So now we're going to talk about making the pyramid work for you by engaging in an exercise that applies this work to your own organization's efforts. First, I want to say that your organization certainly might do work in a lot of these different pathways and be interested in several of these impact domains. Of course, that's very normal and worthy. And for this exercise, as we complete the pyramid worksheet, we'll ask you to focus in on one pathway and one impact area and think about the assumptions that underpin the connections between them. And you can certainly complete this worksheet multiple times for different pathways within your work and then sort of step back and see how it all fits together. Another thing to point out is that we want to just note that as an organization, you may have a wide range of initiatives. And while you're going through the worksheet, you may decide to fill it out with one of those initiatives in mind and or complete the worksheet at an organizational level. This worksheet is intended to be flexible, to be accessed at either of these levels. And finally, if you certainly have your own framework already that you sort of align with in terms of thinking about how your activities lead to outcomes, certainly we think that there's value for bringing that out and reflecting on the pyramid in light of that, and seeing what connections and what questions sort of rise when you look at your own framework through the lens of this pyramid as well. So again, when you're in measuringforsuccess.com and in the impact pyramid space, you scroll down to the bottom and you'll find the PQMD impact pyramid worksheet, which you can download and open up. As you're going through this, you'll see there are 3 sections. So I'm actually going to show you, this is a blank version, and I'm going to show you a completed version example to give some details and perhaps bring to life a bit as you look at a completed example. So the first section asks you to check the box next to one impact domain that your organization is striving toward, and then answer the questions about that impact domain in the table below. The questions being asking you to take this impact domain and describe specifically within this domain, what is your organization contributing to in terms of changes? The next question, how will you know these changes are occurring? And finally, what data sources and or tools would you need to capture this? So under access to medicines, I'll give you one example that we completed in this worksheet based on real programs that are out there. In terms of the specific change this organization is seeking, working with people living with chronic health conditions to ensure more regular ongoing access to needed medicines through donations. One of the ways that this organization can sort of pulse check whether these changes are occurring is looking at utilization and retention rates of these needed medicines in the key population over time. And finally, in terms of data, how that data can be obtained, in this case, medical health records or community-based surveys in terms of access. The next section brings you down to the bottom of the pyramid to identify a pathway. Choose one that's important to your efforts in driving the impact you selected above. In this case, signature donation efforts was selected, and the questions are similar to the above, asking what specific activities your organization will use within this pathway area, how you'll know whether you're delivering effectively, efficiently, and appropriately against these activities, and finally, what data sources and tools will you use. In this example, this organization is responsible for securing the medicines to ultimately ship to partners on the ground. And one way to sort of keep track of how well you're doing at that activity is to look at the volume of medicines that you're securing on an annual basis, ideally through something like an inventory database. Finally, the last step is about connecting the dots. And here we're sort of building on the notion that for such activities to lead to an impact, there are certain key assumptions that underpin that connection. And it's important to understand and explore those to really get a sense of what sort of risk might be introduced and how you might be able to prepare for that. And so we ask you to think about what must be true for your activities to lead to your impact, and how can you explore that assumption. And so, for example, for patients with chronic health problems to ultimately get access to the needed care, they must be aware of opportunities for care. And in order to explore these assumptions, an organization might think about doing some sort of quick informal interviews with key members of the community, key informants interviews, and possibly through working with patient advocacy groups or other groups of people that are sort of already charged with thinking through this work to get a sense. So that's the worksheet. Thank you so much for spending time with us today. I think as you're going through, please keep in mind that PQMD is always very interested in hearing about your journey, in supporting this journey, and know that you can always reach out to PQMD to share, learn, and explore, and continue to build ultimate impact through the impact pyramid. Thank you and have a great day.